Here we go.
There we
All right,
go.
ladies and gents, welcome back to the stream. Happy Friday, everyone. Happy Friday. And this is our second episode on new journeys with autoimmune conditions. Here I go. I got to get used to saying my own titles for this thing. Folks, I am Kareem, and we do have another special guest in the show today. Folks, clap your hands, bow your heads, play some music if you want to. Welcome Dora Chan to the stream, and she is a holistic nutritionist. How am I saying this? I don't want to say this backwards, so you can help me out with this, Dora. A pharmacist and holistic nutritionalist. That sounds a whole lot better, right? That rhymes
Yes.
off the tongue.
Mhm.
Welcome to the stream today, Dora, and I do thank you for jumping into this to share some insight on autoimmunes. Specifically today, again, on neuromyelitis optica and NMOSD, ladies and gents. So if you found some good information on the first stream, welcome back to this because there's going to be some insight on nutrition to lighten your load on inflammations and triggers and such of those things. So, yes, let's get this started, ladies and gents. So, Dora, you are a holistic nutritionalist and pharmacist. What exactly is that?
Okay. Well, I guess everybody knows what the pharmacist piece is, right?
Mhm.
So I guess,
Hopefully.
yes, hopefully, and unfortunately for some. Yeah, so pharmacist is my first profession. So, oh my gosh, I've been a pharmacist for 25 years. So that's my first profession. And most of it's been a variety. So I worked in stores, I worked in a hospital, but most of it's been working in like a primary care, ambulatory care setting, just working directly with patients. And then I guess about 5, 6 years ago, I kind of pivoted a little bit. I moved to California and I decided, I don't know if I want to keep doing pharmacy. So I went to what my passion's always been is nutrition. So I went back to school and I did a nutrition degree. And now I call myself a holistic nutritionist. And I focus on looking at things from a functional medicine point of view.
Mhm.
And you're
Okay.
probably thinking, what the heck is functional? What does functional medicine even mean?
Well, I know what it is, but for the folks who are just kind of like, what? Never heard that
Yeah,
one before.
most people have never
No.
heard of it. And honestly, 6 years ago, when I first started doing nutrition, I didn't really know what functional medicine meant either. But once I learned about it, it's sort of that kind of aligns with what I wanted to do with my life, which is basically, I guess, if you think about NMO or any autoimmune disease, so something happens. So for us, it could be neurological. We lose our sight, we have pain, we get paralysis, etc. And then we go to the doctor and they do all the tests and they say, oh, turns out you have autoimmune disease. Let's give
Mhm.
you so this immune suppressant medication to make sure you don't have any attacks. End of story, right?
Right.
So that's the pharmacist conventional medicine part of it. But then on the other side, the functional medicine part of it thinks, well, what actually caused that autoimmune disease to happen in the first place? So, was it something in your diet? Was it something in your genetics? Was it something in the environment? What caused it in the first place, and what's still driving it to occur now?
Right.
So, even though we're throwing drugs at it to calm your immune system down, we're still not actually fixing the original
The
problem.
problem.
So, functional medicine looks at that original problem and we try and mitigate those things. And often
Right.
that means making changes in your diet, making changes in your lifestyle. There's all kinds of fancy things you can do too, like checking on your genetics and checking on your microbiome. But like a lot of it's just going back to the basics. So
Right. Right.
that's
Yeah.
that's sort of the functional medicine lens. We kind of look at the person as a whole instead of just looking at you as an autoimmune disease and we just throw drugs at your immune system.
Hmm.
A
Yeah,
little
that was
too
my first.
simple for me.
Yeah, no, that was my first introduction while I was in the hospital. I was in the hospital for 2 weeks, and then I think the last no, and I think the last time I've been in the hospital was the day of my birth. And then to be in there and be lined up with pills on pills on pills on pills, and then there's this other machine, and you're going, what is this thing for? Uh, yeah, that was pretty overwhelming,
Yeah.
pretty overwhelming. And I don't think I can ever get used to being a patient, lightly saying. It's just a weird thing to
Yeah.
actually go through. And on the pharmaceutical side, like the steroids that you get pumped up with, you feel like a layered cake after a while. This things just
Hmm.
start swelling up, and you're just like, wait a minute
Yeah.
now, I had a flat stomach. What just happened here?
Yeah. Everything just changes. And don't get me wrong, like I'm still on the medications, and when I
Mhm.
need the steroids, I take them because it's
Mhm.
life-saving. And honestly, like we don't want to have another flare.
Sure.
So it's still an important piece of our toolbox, but like why not work on the things that are causing it in the first place, right? If
Right.
at any point we can actually minimize what we need medication wise, I'm all for it.
So as a person who is on both sides of the fence, and you've seen both sides of the fence, and you see how it affects, well, one, yourself, and people on the other side of it, how do you how were you able to really, like, one, carry on, and two, manage symptoms for yourself?
For myself, well, I guess to be honest, I've been fairly lucky. I've been quite stable for a long time.
Mm,
So I think when was I diagnosed? My first symptoms were around probably 2008 when I lost my sight.
mm,
And that took a few weeks, actually, probably a couple of months to really recover. But then from then until my next attack was probably 2 or 3 years. And then I had another
nice.
attack on my spinal cord, which was mostly just pain, lots of nerve pain. And that took a
Right.
few months, half a year to recover. But since then, that was probably 14 years ago was my last attack. So I've been
Wow.
fairly stable. So I'm on my regular immune suppressants, but I don't have any other medications. So
Awesome.
I've been lucky
Awesome.
that way. And I don't like, is it luck? Is it my genetics? Is it what I'm doing to reduce inflammation in the background? I don't know.
Right. Yeah.
But yeah, so I still do both things. I still have my medications, but I still work on those other things to help balance out my life and reduce the inflammation. That makes sense.
Sure. Yeah, absolutely. So let's jump into, like, a little more into the nutritional part and just go into the gut area, right? So a lot of people, when you say change your diet and the dietary part, a lot of people think, well, I eat pretty well and a this and a that, but it's kind of like, hey, that pastrami, it's not doing it for you, buddy. It's packed with this and that, and then,
Yeah.
all the salts and stuff in there. Um, the gut health issue, I think, from what I hear, the gut is like the second heart, or maybe the first heart. How do you go about changing the rhythm, if I may use that word, for
Mm.
what the gut would usually ingest, to cycling that off, um, to patternize something different where it really accepts what's going on that's different, if that
Mm.
makes sense to you?
So are you asking how to, I guess, really improve the health of
Right.
your digestive tract or your gut health?
Yeah,
Yeah.
exactly.
Yeah. So let me step back a little bit for people who don't get why we're talking about the gut. So in my world, there's something called the autoimmune triad. So what is actually causing autoimmune disease? So there's still like nobody actually knows exactly what autoimmune disease comes from, like why it's happening.
Mm,
But there is something we call the autoimmune triad. So this is what it seems like. There's three things. Normally, there's some kind of genetic predisposition. So something in your genes makes you more likely to get it. So if you already have family members who have autoimmune disease, especially if
mhm,
it's your parents or siblings, then you're probably more likely to have autoimmune disease yourself. So there's something in their genes that have made us more susceptible. So that's the first thing. And then the second thing is there's usually some kind of gut permeability. And what that means is, so in your digestive tract, so I guess if you look at, if you think about your intestinal lining, you have like all these, I don't know, sausages, right? Your intestinal tract. So your food comes in and it goes through your intestinal tract. And ideally, the food kind of stays in your intestinal tract. So
Mm.
around your intestines are really, really tight cells that keep all the food in, except it does allow a few nutrients and things like that. And there's special passages that go from inside your intestines to the outside, from inside the intestinal tract into your bloodstream. But most of the
Mhm.
time, whatever's in your intestinal tract, so the food that goes in, the waste and everything, it stays in there. Okay. That's your normal digestive tract. But sometimes that can cause, it can become leaky. So in
Mm.
social media, or like common term is called leaky gut. So instead
Yep.
of that intestinal tract being a nice closed sausage, you get little teeny holes in that sausage. So your food is going through, but things start leaking out into your bloodstream. So
The
whether it
visual in my head is crazy right now.
and they're very tiny holes, right?
Oh
But
my
in those
God.
tiny holes could be like food that's been undigested. It could be any bacteria or viruses or whatever that you've swallowed. They're kind of
Mm.
like coming through the holes and getting right into your bloodstream, which is not supposed to happen. So as you can
Mm.
imagine, if things are kind of leaking from your gut into your bloodstream, then your immune system starts freaking out. And they're like, well, what
Right.
the heck is coming into the bloodstream? We got to start attacking. So
Right.
then that way, your immune system is ramped up. So that's the second piece. So first you have genetics. Second is that leaky gut or something happening in your gut that causes your immune system to be on high alert. And then the third thing that we need for that autoimmune triad is some kind of trigger. So the trigger could
Mm.
be anything. So it could be you have an infection. So when we had the whole COVID thing happen, there's a lot of autoimmune diseases that developed. So that could be a trigger. It could be any type of infection. It could be foods. So if you have certain food sensitivities, that could be your trigger. Stress can be a trigger. Medications could be a trigger. So that trigger could be anything.
Right.
So when you have those three things and they kind of just all align, then that's when you get autoimmune disease. So for
What about
me,
traumas? I'm
trauma,
sorry. Yeah.
yeah. Trauma.
Yeah.
So that's stress. So for sure, trauma. I was gonna
Oh,
say for me, like I'm only guessing at what my triggers were, but obviously I have some kind of genetic predisposition to my gut was okay, but I was eating a lot of crap. Like I was eating lots of
mm.
chips, lots of sugar, lots of chocolate. I wasn't really paying attention to stuff. And I have a whole lifetime of like being on antibiotics for colds and things. So I'm sure my gut health wasn't perfect. And then
Right.
my thought for my trigger was I had, it was like a there's a flu shot that we had that was very specific. I don't remember. It was like a particular year we had SARS, and then it was like a very special flu shot that was back in the SARS time. There's a name for it, but I don't remember what it was called.
It's right on the tip of my tongue.
Yeah,
It just won't come out. I get
yeah.
it.
But it was like a very specific, different flu shot that was different from prior years, and I had that. And then I think it was those three things that sort of riled up my immune system. And then like two
Mm.
weeks later, that was my first symptoms of NMO.
Wow.
So
Oh
anyway, so
man.
that's this autoimmune triad. So there's always these things. So then when I work with autoimmune clients, then obviously I can't do anything about your genetics, but we can
Hmm.
work on improving your gut health. And then we can kind of work on trying to figure out what those triggers for you were. So is it
Mm.
food? Was there some kind of stressor? Is there something in your environment that's triggering things? So those are the things
Yeah.
that. So
Gotcha.
then your
Yeah.
question about how do we improve gut health then? Um, I guess there's two pieces. So one, we have to kind of help figure out what is causing issues with your gut. So is there certain foods that bother you? Is there certain medications? So if have you heard of NSAIDs? So
Yes.
pain medications like aspirin or Advil, Motrin,
Hmm.
anti-inflammatory medications. So those
Right.
can be quite harsh on your digestive tract and your stomach. So sometimes that can be an issue for your gut health. So just looking at those potential reasons and fixing those in itself can help with your gut
Hmm.
health. And then I look at your microbiome. So your gut is made up of trillions of bacteria, viruses, all sorts of little microorganisms, and they have to be in like this nice little balance.
Right.
So if at any time one certain bacteria overgrows, it can cause all sorts of issues. So we need to have a really nice balance. And normally, to have that nice balance, I really focus on fiber. So dietary fiber, because bacteria really love to eat fiber. So when you feed them
Mm.
good types of fiber, then your good bacteria kind of flourish and they balance out. So then we work on food and fiber and feeding your gut the right things.
Awesome. Yeah.
So yeah,
What do you think about? I've been seeing a lot of advertising about this whole oil of oregano and black seed oil, and I know they're pretty good things to have.
yeah.
What do you think about that? Because I mean, the best and worst thing we have now is entertainment, you know. And because all of a sudden you just see this influx of just advertising one specific thing,
Yes.
like and you're going, okay, it's too much. It's got to be too good to be true at this point.
Yes.
Once, twice, three times, okay. But every single channel, every single internet advertisement, every single, it's kind of like, all right, guys, what are you doing here? This is the
I know.
brainwash. What do you think
What's the
about
real? I know. And I think you're also a wellness professional. I think it's like a hazard of our profession. There's all these like shiny
Yes.
supplements, shiny things. And oh my goodness, my cupboard is full of all these supplements because somebody had said this is good, and I have to try all of them. It's crazy.
I
But
have my thing right now, I've just got magnesium supplements in there right now. And I'm good with that. It's
yeah,
just kind of like, okay, this is way too
yeah, I
much.
kind of
Way
just
too
like
much.
choose my favorites. But yeah, I fall for all of those. Well, it's my job. I got to try all of them.
And just to say good, good, good,
Yeah.
garbage.
So here's the thing. It's very individualized, right? So I can't say that one supplement, well, I guess some supplements, yes, are probably garbage. But in
Yeah.
terms of like you pointed out oil of oregano and black seed oil, they're both very good, but they have very specific purposes. So I wouldn't say blanket, this is the one supplement that everybody should have because
Right, right, right.
everyone's different. So for example, like oil of oregano, I typically would use that for gut imbalances in terms of microbiome. So
Hmm.
it's a really strong like antimicrobial agent.
Gotcha.
Also has like anti-inflammatory, antioxidant things, but I always think of it as a really strong antimicrobial. So if someone's got
Yeah.
really um if they've got like gut microbiome issues, and I've actually done some screening tests and I can see that there's imbalances in the bacteria, then I might suggest oil of oregano. Or some people like if they catch colds or they have some kind of respiratory infection, they'll take a little bit of oil of oregano. So it's
Mm.
very specific. I don't tend to recommend that for everybody. And then
Yeah.
black seed oil is, I usually think of it as like a really good anti-inflammatory agent.
Right. I I think that's the one thing they all have in common is the anti-inflammatory
Mhm.
properties, right?
Yeah. And honestly, just thinking about plants and herbals in general, I feel like they all have some kind of anti-inflammatory.
Yeah,
So
sure.
just on a more natural side, like not thinking about supplements, but just herbs and spices and vegetables and fruits. All these like natural plant things, they all have anti-inflammatory, antioxidant properties of some level.
Yeah, yeah.
Need to get more of them in your life.
Yeah. So we're on that. And I hate using the word best. It's just such a uneven scale when you try to put them together.
Hmm.
But the most effective as far as foods, right? Because we're all humans, we're omnivores. Like, what do you see the biggest change? Where it be more plant substance foods or meaty foods?
Tough
She
question.
laughs. I
That's such
love the
a
laugh.
tricky question. They're neither
Neither.
or
Okay.
both. It's the same
Depends
as
on
what
where
I
you are.
exactly. It's the same as what I
Yeah.
said about the supplements. Everybody is really different in their genetics and their preferences and their lifestyle. And what works for one person, doing all plant-based versus
Mhm.
like doing mostly animal-based, everyone's different. So I can't really say one is better over the other.
Right.
But I
And
guess in general though, like I like to be more balanced about it.
mhm,
So making sure you do have a lot of plant-based foods. Um, how do I explain this? I guess this is what I tell my clients if they're omnivores, or I guess even if they're not omnivores. I usually tell them to do the plate model. Have you heard of that? You probably.
yes. Yeah.
So if you think of your dinner plate, lunch plate, breakfast plate, whatever it is, fill half your plate with veggies, so non-starchy veggies, ideally.
Mhm.
And then a quarter of the plate is your protein, some high quality lean protein. And then the quarter of the plate, or even less, is your starch. And that's how you fashion all of your meals and even your snacks. You can fashion that way. So mostly plants, especially your veggies, and then quarter protein, quarter starch. And by starch, I mean starch is like corn, potatoes, sweet potatoes, cassava, flour, rice, all those.
Roughages. Yeah.
The things that
I
everybody
love those
really
things.
loves.
Yeah.
But just a quarter or even less of your plate is the starches.
Yeah. Don't be gluttonous, folks. I mean,
Yes.
those foods do taste good, but bring it
Yes.
down a little bit.
Mhm.
Um, so we're on this topic of like foods and how it can mitigate like flare-ups. What do you think? Because I'm sure you've heard this before, being your blood types. People eating for their blood types. What do you think about that? And is how does that work its way in or
Mm.
not with our conditions or other autoimmune conditions?
Yeah, I haven't dug super deep into the blood type diets, so I kind
Mhm.
of know surface level. So yeah, so there's this concept that if depending on what your blood type is, you eat in a certain way. Um, and for the most part, like if that's something you want to try, I'm open to it because it still brings us back to eating less inflammatory foods. So,
Right.
and by inflammatory foods, it's the bad foods that we typically think of, right? So like fried foods, fast foods, like lots of sugary foods, all those things that you know we're not supposed to eat. That blood type diet also removes that. So
Hmm.
I think it's good in that way. And then I also wonder when you're focusing on your blood types, maybe it's partly your genes, right? So your genetics
Mhm.
will dictate how you process certain foods. And maybe
Right.
someone's done kind of like the research and figured out, oh, this blood type tends to process food this way and this way and this way, and maybe that's how it works. I don't know. I'd say it's worth a try as long as you're getting all the nutrients that your body needs.
Yeah, I feel like it's such a one, autoimmunes are so stupid because you just don't know where to go with these things. It's kind of like you're here, there, back around the corner, back up the block, around the corner, and you get right back to point A, and you go, well, we tried everything. We don't know what else
Yeah.
to do. It's just a dumb
Yeah.
thing to have. So if you can help it, ladies and gents, don't get autoimmune condition.
Yeah.
You can help it.
Yeah.
Oh my gosh.
And then
Um,
I guess to prevent the autoimmune then, so if you know your mom has autoimmune, then make sure your gut health is good, right? Have
yeah.
lots of those plant foods with lots of fiber. Don't be eating all the crap. Get some sleep, get some sunshine, do stress reduction techniques if there's a lot of stress in your life. Like do all the things that we know we're supposed to do. Exercise, right? Treat your
Yeah.
gut well. So if you're already having gut symptoms, and by gut symptoms it'd be things like constipation. So if you're not pooping every day, or you're
Mhm.
pooping too much, or you have loose stools, or you have lots of gas, lots of bloating, lots of burping, like any type
Mhm.
of like digestive tract things going on, then you're probably already starting to have gut issues.
Yeah.
So you really
Yeah.
want, if you're already having that and you don't yet have an autoimmune disease, then you really want to start focusing on your gut health and
Sure.
not by just throwing medications at it.
No band-aids on the boo-boos. It
No
doesn't solve
band-aids. Yeah.
anything.
Yeah.
So you mentioned sleep and sunlight, right? Two biggest factors as far as just recovery and just overall health. What do you think about these artificial that could be triggers like lights inside your house? How effective, excuse me, how effective or ineffective is that towards the condition and to sleep? Because a lot of people they cannot either one turn off the TV or put
Mhm.
that cell phone down, which those blue lights they just happen to keep you up, which is a big
Yeah.
no-no. Um, how do we mitigate that to the autoimmune conditions, and how risky is that with another flare-up, if that can be a thing?
Hmm. So are you talking about actually using light therapeutically
Thank you.
or
I was supposed to ask you about that too. What about therapeutic lighting? Because I've heard about what is this thing called? Red light therapy.
hmm
And I almost I was this close to actually doing it, and then something else happened and I just got detracted. So I was never able to really experience it and talk about it. But thank you for bringing that up. What is your thoughts
Okay.
on those
Well,
things?
let's talk about, I guess, light in general.
Yeah, let's go for it. And then we
Um,
can break it up as
okay.
we
Well,
need to.
first of all, sunlight is so important. Like I don't know that everybody knows just how important it is. And it's not just because I'm sure most of us know we get vitamin D from sunlight. So
Yep.
when sunlight hits our skin, our body will naturally create vitamin D from the sunlight. So you already know sunlight's super important if you already have body processes that rely on the sunshine. But I don't think that's the only thing. It's not just the vitamin D. There's something about sunlight that your body needs, well, I don't know, for everything.
Yeah, and it just
Particularly,
makes you feel so good.
yeah.
Like it just wakes you up. You know, that's
hmm
why the wintertime sucks in New York. Like,
Yeah.
where are you? Are you in New York too?
Yeah. And
Yeah,
I
it's
I don't forget I forget like the deep science bits of it. So you'll have to excuse me. I don't know all the exact mechanisms, but
it's
the
pretty dense.
sunshine drives like your mitochondria, how your body creates energy.
Yeah,
So it's really important. Anyways, so really important to get sunshine, especially in the morning, because that'll trigger your body to kind of wake up and
yeah.
create the hormones to wake up and sets your circadian rhythm. So if you're already having trouble sleeping, actually getting morning sunlight and setting your circadian rhythm is really important. And it's really important for your immune system. And then at nighttime, like you said, is when our body is supposed to like start shutting
Shutting
down,
down.
getting ready for
Yeah.
sleep. And that's when the sun's supposed to go down. So when we have all our devices on at nighttime, our bodies kind of think, well, it's not really nighttime, it's not time for sleeping. So ideally, like an hour or two before you want to fall asleep, you should be like shutting down the lights. And then I know some people like putting red light bulbs instead of regular light bulbs at night to help that process. Um, so yeah, so really important just to get sunshine wherever you can. But then obviously, like when you're in places like Canada, where I'm from, wintertime, it's really hard to actually get sunshine. And you've probably heard of like seasonal affective disorder, where people
Yes.
actually get depressed over the wintertime because of the lack of sunlight.
Yeah.
So if that's something that you're dealing with in the morning, you're not getting enough energy and your mood is coming down, especially in the wintertime, there are like light boxes that you can get. And you can just put them on your desk and shine it on you in the morning. And that's just like a
Mhm.
regular light box. You can just get it from Amazon, and that
Wow.
can be really helpful. And
I've
then
never
you
even
brought
heard
up,
about that.
I think it's called a Lux box, maybe Lux. Anyways, you just like look up light box for mood or or whatever, and you
I'm
can find out on Amazon.
writing that down.
And then specific to what you were saying, the red light therapy, um, that goes on an even deeper level, and it's the red light that actually stimulates and affects your mitochondria for healing properties.
Mhm.
So I think a lot of people use it for recovery, like if they have injuries. I've been using it. I've been having thyroid issues,
Okay.
so I'll actually shine it on my thyroid in the evening at
Wow.
to kind of help with that. So there is data for even doing that. Of course, check with your doctor before you do any of these things. But
Sure.
yeah,
Yeah.
and red light, I'm sure you've seen those masks
Yes.
on
Yes.
social media. It's supposed to like stimulate your collagen and help improve your skin. So yeah, there's all this like really great research actually for red light therapy.
So do you actually do you feel different when you put the light on your thyroids? Like, I mean, you don't
No,
expect to feel it. No, you don't.
no, not when you're not for something like the thyroid. It's a little harder to feel.
Yeah,
But certainly like on the skin, you notice it quite quickly. And then
really.
if
Okay.
you use red light for recovery, have you used it for any of your patients or your clients?
No, I have not. No.
Yeah. For like pain
No.
and recovery, red light is very good too.
Okay.
And that works
Yeah.
pretty quickly.
When I was investigating it, I wanted to see if it could have any positive properties on myelin repair because,
Mm.
right. So I have the whole transverse myelitis thing,
Yeah.
and it affected my legs like,
I
well, to
wonder.
a big degree, coming from a guy
Hmm.
who runs and cycles and boxes, like legs
Yeah.
are everything. So thankfully, I was able to break the whole really downward trajectory of transverse myelitis. The only things that I
Hmm.
can't, well, I don't want to say I can't, that my body does not recognize at this point is jumping and running,
Hmm.
right? So walking, it's fine. My legs just have to understand, hey, don't speed away, So I'm still working on like
Yeah.
um a little bit of gait and speed and control, right? So
Hmm.
once I get walking, my body's like, oh, we do this. Let's just go. And I'm just like, no, no, no. We have to slow
Yeah.
down.
Yeah.
So yeah, I was really trying to investigate it to see if it can have some upward healing properties to like
Yeah.
myelin repair.
I
Um,
wonder. Have you looked into the research, whether
I have, but there's nothing
nothing, right?
definitive that they're giving you,
Mm,
and I'm looking for one, two, how long does it take for my lean sheath to actually repair?
yeah.
Still no concrete anything
No,
on that, So it does repair, but it's probably working as slow as
it's
how
super
nerves repair,
slow.
you
Yeah.
know. So
It's
it's
super
it's just
slow, and then I guess it really depends on how damaged too. Because at some
yeah.
point it's difficult to repair it and regenerate
Yeah,
it.
it really sucks.
Mm.
But I guess again, I'm only attributing this to me as far as maybe athleticism. I can jog in place for about 8 seconds before my legs look like spaghetti falling out of a plate.
Mm.
Compared to me trying to do that prior and it'd be like, okay, somebody catch me now.
Hmm.
So eight
Yeah,
seconds to falling, I think that's a very big plus. So I'm
that's
hoping, yeah, right. Clap that up.
awesome.
I'm hoping that that is something with some sort of repair and not just the
Yeah.
steroids that's just being pumped in every 8 weeks,
Hmm.
So yeah,
Yeah,
it's such a tricky thing,
it is.
such a tricky
I
thing.
guess like if you have the money or if you have access to red light therapy, whether it's just like a device or like you can actually have mats, like red light
Yeah,
mat, it's
yeah.
worth a try. And there's also a new thing that I've been looking into. Have you heard of super patch?
Super patch, no.
Mm-hmm. So I'm just starting to dabble with it. So
Hmm.
maybe, I'm just wondering if I could send you samples, but I don't think I can. So there's this thing called super patch. So it's like about this big. It's a little plastic. I don't know what it's made out of, but it's a patch that you put on your skin, and
Uh-huh.
there's no drugs. There's no like chemicals in it, but it basically works on stimulating the nerve receptors on your skin somehow.
Okay.
So when you actually touch the patch, you can feel like there's little ridges. So
Uh-huh.
apparently those little ridges will stimulate certain receptors in your skin um, to cause an effect. So there's
Mhm.
patches for helping to reduce pain. There's patches for helping you sleep, patches for stress relief, but there's also a patch for building strength and for balance,
Oh, wow.
which kind of made me think of you a little bit. And I wonder if that might be something just to help give you a little bit more edge with your walking and running.
Huh. I'll
And it's
definitely
like,
delve into that for
because
sure.
it's drug free, I'm always like, oh, anything drug free. I want to try that. But yeah, that's something you might want to look into. I can send you more information about it later.
Absolutely. Thank you so much for that.
Mhm.
Ladies and gents, I hope you're having fun with this stream. It's not meant to be like super serious and down and depressing. Like I don't want to say be like me, but look, man, you got to find your way in laughing and smiling, although you have like such a crazy thing going on inside of you, right? So
Yeah.
definitely take care of yourself, but have fun, laugh, express
Yeah.
yourself a little bit. You know, nothing has to be super, super serious and
No.
all sophisticated. Like,
Yeah.
I want this to be fun, friendly, and just easygoing. And, we can laugh at certain
Mhm.
things. So, you
Yeah.
know, follow me through this, ladies and gents. This is me naturally anyway. Can we jump into and tracking symptoms and overall health as one goes through the journey? How one individually, how should that person track it, and how would a functional medicine doctor track that progress of an
Hmm.
individual?
Well,
Excuse
I guess tracking is really, for me, when I do it with my clients, we kind of do like we kind of take inventory of our symptoms.
me.
So when I first start working with someone, I have like a little questionnaire, like with numbers, and we
Hmm.
just track all the symptoms. So not just whatever pain that you're feeling, but what gut symptoms are you feeling? What brain symptoms are you feeling? Um, like nasal symptoms, anything, like your whole body.
Yeah.
What symptoms are you feeling? And we give a number to it. And then as time goes on and you make changes to your diet, changes to your lifestyle, we do whatever, take medications, then maybe a month or two later, we do the same inventory. What's
Mm.
your level of symptoms? What's your number? So always having some kind of like symptom survey, I guess you would call it, and
Right.
a number to track, then it's easier to actually see what your improvements are. I guess
Gotcha.
that would be
And
the easiest
does
way.
Got it. And so as you're tracking it, and if things change, they go higher or lower,
Hmm.
does the treatment plan for that person, does that change or does that stay standard
Nope, it changes all the time.
all the time? Got it.
Yeah, all
Got
the
it.
time.
Okay.
Because not just in terms of whether the symptoms are going up and down, but like, I don't know, I'm making this up. If I tell you to start eating a certain way, and then 2 weeks later you'll be like, Dora, I really hate eating XYZ. I can't eat this anymore. And then I got to change everything up again.
What do
Or
you mean no cookies in this plan?
yes, or the same thing. I give you a supplement and then a month later, Dora, I can't even afford this anymore. I can't do this. Then I got to change this again. So
Mm.
everything is changing depending on our life circumstances, our symptoms. Yeah.
But I guess it keeps you on your toes as well, just
On
to
my
make
toes.
sure like, yeah, so just to make sure like things are going off in your head, and
Hmm.
this you can see some change in this
Hmm.
person, even though
Yeah.
the plan keeps changing back and forth.
Yeah.
So
Yeah. And your
I guess it's a
priorities
good and a bad.
change, right?
True, true. So I guess it is I won't say good and bad, but it's necessary, I suppose. It's
Hmm.
definitely necessary. What else do I have here?
Well,
Do you have any?
I'm
Yeah, go
curious about
ahead.
how do you keep track of whether you're doing better or not?
Kind of the way you said it. I just keep mental notes. I don't write everything down, although I am a writer by nature. So if I do feel something that is not uniform, I
Hmm.
definitely scribble that down. But I'm really good at just keeping the mental check and the physical check. So thankfully, I've never really had pain, but it's just overall feelings of, like I was telling you this morning, ladies and gents, I woke up with, let's call it a flare. but it's a very familiar fear. So if you've ever had it, the tight sensations in the abdomen and the lower back, and sometimes it goes up and down my upper back and lower back. Uh, I woke up with that this morning. I want to say maybe about a 62% in feeling. So fairly uncomfortable, but I'm still functional. So I woke up with that this morning. And what I usually do, Dora, is just kind of see if it's just in those landmarks of my body and if it's more than what it was prior.
Mm.
And I just keep the mental check there. And then from there, what I do is I just go on with my regular day and see if anything is more exasperating or if it's kind of dissipating throughout the day. So just being physical that way, I don't let it stop me.
Mhm.
Um, but if I feel like something is debilitating, and thankfully we've never been at that point, I know to pick up that phone and say, "Hey, doc, I'm coming in."
Yeah.
But other than that, like things for me have been pretty standard and uniform. I think at this point, being in the hospital for 2 weeks, I know how to manage certain things, and just from all the literature, that stint in the hospital was very educational for me, although I didn't want to be there, but it was very educational. It was a lot of reading that I put towards myself, and I think that's how I cover my bases. Just go on overall feeling, where it is
Yeah.
on the Richter scale.
Hmm.
Is this familiar? And I
Yeah.
just kind of went along with that.
Yeah. Yeah. That sounds similar. But
Yeah,
I do have to say there is a power in writing it down and seeing it.
yeah,
So many
absolutely.
of my clients like will have the baseline symptoms and then
Hmm.
the next one I show them and they don't even realize how much improvements they've made on themselves. And they
True.
wouldn't have seen that if they didn't actually have written it down somewhere. Because I
Hmm.
don't know, I guess you get used to what your body's doing, so it doesn't feel that different anymore. But if you've
Yeah,
written it down and you have a record of it, then you realize, oh my goodness, I've done so much.
yeah, no, true. I totally agree with that. Totally, totally agree.
Yeah.
Yeah, write it down, folks.
Yes.
Write it down. Just
I feel like
don't,
almost all of my clients sell themselves short.
yeah, you write it down so you can see it for yourself. And then when things happen again, you can definitely do the comparisons on the notes and you go, you know what, I'm all right today. I'm not calling with any, I'm good, So definitely write it down. Listen to
Yeah.
your body, listen to it.
Yes.
Um, did we go over collaborative collaborative footnotes? So we've covered the basis of nutrition. Do you think it is a good collaboration between pharmaceuticals and the holistic approach of everything? Do you combine them at all, or is just that like one philosophy versus the other philosophy, or is it really good to collaborate the two worlds?
Mhm. I guess in the ideal world, yes, we would always collaborate.
Yeah,
So if you went to your neurologist, ideally after the neurologist, you would see the nutritionist or someone holistic who will also help you with that side of things.
yeah.
But that doesn't happen.
Unfortunately, my nutritionist in the at Lenox Hill would always come up and say, "Well, if this doesn't work, we have this pill for you." I'm like, "Dude, like, seriously? Stop! Like that part is overwhelming. Can I get the salmon and broccoli, please? That's that's all I want.
Yeah.
That's it."
Yeah.
But yeah, that it,
No. Yeah. Always, whenever we can, we want to have both sides because there's benefit from both, right?
yeah,
But
yeah,
really, like in terms of my work, you really have to have a good practitioner, especially your medical conventional practitioner. So some are really open to it and some are not. And you have to figure out what your practitioner is like.
yes. I think, and this is just me, ladies and gentlemen, have caregivers that are pretty open-minded and not closed at all.
Yeah.
So even if you mention holistic stuff, they don't shut you down and tell you you're in timeout and they tell you to face the wall.
Yeah.
I mean,
Good.
unless that's what you're good with, I
Hmm.
think being open-minded is good. Because then I think you learn a lot more, about your condition and how you were able to like handle things and walk through that
Yeah.
part of your life. So yeah, just be open-minded with things. And again, if you get put on timeout, it's time to look for some new caregiving
Yeah.
advice, I
I would
believe.
think so.
Yeah,
And of course, not saying like I wouldn't say go to your doctor and reject what they're saying. It's just like adding in a different layer of help.
absolutely. Yeah.
Mhm.
I remember there was one lady that came to me. Um, well, she was pointing in my direction. So she didn't outright come to me, but she wanted the advice. And, we spoke, and I'm not the one to say I want to give advice. I really don't even like using that word, just like the word best. But I would always point you in a direction. I would give you option A, B, or C.
Mhm.
And no matter what this lady asked, and I would give an option, she was just like combative outright. She was like, "Oh, I'll ask my therapist about this." Okay.
Okay.
So what do you need me for? It's like you're asking me the questions, I'm giving you options, but you
Hmm.
always want to reconfirm with your therapist. I'm just like, well, maybe you should just stick with your therapist if you just always want a third party answer. Like, what are we really been here for? So that part was frustrating.
Yeah.
That was frustrating. You're just navigating away from everything that I'm saying. So I was like, hey, well, you have a nice day.
Yes.
You have a nice day. And
Maybe not,
sometimes it gets like
maybe
that,
not the
ladies and
best fit
gents.
here.
Yeah, it gets like that sometimes, ladies and gents. I know I sound real cruel and cold saying that, but it does get that way. And
Yeah.
sometimes you just have to fire people before you even begin with them. It's
Yeah. And there's
go
always
that way.
like there's always going to be people that you just don't align with,
Yeah.
and that's okay.
Yep. It is. It really is. And the topic of saying okay, ladies and gents, it is okay to not be okay, especially dealing with the things that we're dealing with on the inside because
Mhm.
we cannot physically touch it, and that is absolutely fine to
Mhm.
not be a best at that point in time and hopefully it doesn't last for too long, but if it does, it's fine. You're dealing
Yeah.
with something, own it and tread lightly with a light stick because
Yeah.
things do happen. You are living your life, it is your truth. Be patient with yourself and be
Mhm.
patient with that time that you need to ride out that little storm.
Yeah.
How's that
For
sound to
sure.
you, Dora? Is that right on track with that?
That is so right on track. And it really makes me think of like so many of my clients want to make dietary changes, right? But then something happens. You have a flare, you have a really bad day, and then they feel so guilty when they come to me and they're
Mm-hmm.
like, "Oh, I ate this, or I did this, or I didn't exercise." And I'm always like, I don't like, please don't apologize, right? This is
Right.
your life. You do what feels good for you. I've given you the tools. You know how to get back on track when you're ready, but
Mhm.
you never apologize for it, right?
Right. Yeah. Yeah, ladies and gents, we are dealing with and it was cool that I wore this shirt. This was not scripted, but are you familiar? You like Marvel stuff at all?
A little
I have
bit,
the
yeah.
T-shirt. Yeah, so I have the whole Skrull invasion where they invaded Earth and started impersonating the Avengers and stuff. This is
Hmm.
what's happening inside of us, ladies and gents. A whole Skrull
Yeah.
invasion. Like this is
Yeah.
what it is. And we have to be the overall Avenger to like calm things down in our own, like uniform way. So don't be
Hmm.
guilty. Things are happening on the inside and
Yes. And
some
other people
bad,
don't know what's going on. So,
yeah, yeah. And to that point, what do you say to someone, family or friends? Because they don't feel what you're feeling. And if you're having one of those quote unquote bad days, what do you say to someone to say, hey, maybe not today, in the nicest form, but a really direct form?
Ah, I'm not the best at that. I'm probably a bit of a pushover, but honestly, I don't know. My personality is that I don't know. I get along with everyone. I don't cause issues. I'm very patient with people.
Mhm.
So even if someone's getting on my nerves or I'm having a bad day, I
You
still have
just
a
go with
smile
it.
on my face. And I'm just like, all right, no,
See,
I
you
don't know.
are me,
That's
but
just
at a point in time, I really learned to be very direct to say, no, this ain't happening today.
yeah,
Without this, this the Froud Browns and everything like that, I learned
yeah.
to say no, you
Good for
know,
you.
no. Um, but everything that you said, that is me.
Mhm.
You're really mirroring me. I just know how to put the stop sign on the door and say, don't bother
Yeah.
me, you
Yeah.
know.
I guess I've been lucky that the people in my life typically don't bother me too much.
Hmm.
So,
Hmm. And that's one of those things,
yeah.
folks, like you have to learn to say no, or just not today, or
Mm.
just give me some space. That is also part of learning you. It's a growing thing. Like
Yeah.
at some point you learn to say no.
Mhm.
And at some point you have to say
You have
no,
to. Yeah.
because the more you give, the more people want. And that is energy consuming,
Mhm.
especially again, the things that we're dealing with that will
Yeah.
drain you to the fullest. So
Sure.
please at some point learn to say no. Learn to say no.
Yeah.
And
I
if you
bet
don't know how
like
to say it, call me.
I was gonna say, I bet most of us stress is our triggers.
Yeah,
Like no matter
definitely.
what we eat, whatever exercise, stress, I find like that's the biggest one, stress. And the hardest one.
To figure out.
Hmm.
That's the thing. Like that's my thing. Like, because I am so on cloud 100 all the time, even dealing with this. My like my neurologist, he asked me, "Are you ever stressed out? Do you feel depressed?" I'm like, I don't know how to identify. Like, I really don't, because I'm all my occupation. I'm so up in this and this. I'm not sitting down. I am on my feet, even though I
Hmm.
probably shouldn't be on my feet. Like I am going, and I feel like one, the more I'm on my feet, it jars my nervous system to say, hey, we remember this. We have to keep doing this.
Yeah,
So it's like a really good jump start for me. But yeah, those stressors, I'm like,
I know.
I don't know. Yeah, that's a hard question. Like, what
That's
am I
the you
supposed to
you
do?
gotta find a guest now to talk about stress.
Right. Seriously. So yeah, you know what? I'm writing that down too. Like so yeah, no, Dora, is there anything you want to add before we close out? We spent a really good chunk of time on this.
Yeah.
We went a full
Yeah.
hour. This was great.
Sorry if I went too long, but hopefully
Nope,
it's
don't be
helpful.
sorry. This was awesome.
No. What else do I have? I think we covered most things.
I believe so, if not everything, because I mean, everything has this like little sub pocket in there. So I trust
Mhm.
everyone learned something and smiled as much as we did.
And keep smiling.
Yeah, absolutely. But Dora, thank you for jumping into this stream with us. I definitely appreciate it. I definitely had fun with you, and hopefully you'll be open to coming back again and
Yeah, anytime.
having some more fun with us. Ladies and gents, this is the conclusion of our second episode. I felt like I've done 6 of these already. I'm having so much fun with this on the second one. Um, Folks, it's not much more to say here other than to be kind to yourselves and be kind with one another. Explore your journey, because that's all you're probably going to be doing at this point. Explore it, learn from it, grow from it, and have fun doing it. And until next time, we will see you at the same bat channel, same bat, well, not definitely the same bat time, but same bat channel. Okay. Look out for us. and we shall see you soon. Au revoir. And